Hello and welcome to Health Live at Seniors Today. If you're wondering why I'm here alone, is because our guest doctor today, Dr. Jatin Kothari, who is from the Nanavati Hospital in Mumbai, he is busy with a patient just now. Dr. Kothari, as you know, is Director Nephrology and Chief Consultant Renal Transplant at the Nanavati Max Hospital in Mumbai. And he's going to be joining in any minute now. Uh, you know, I have the window in front of me where he'll be sitting. He has advised his colleagues to keep that ready, but he's just attending to a patient. And the last thing that we would like to do in a Health Live session or even otherwise is to uh, uh, take away the doctor from a patient who is needs all the attention. So we are going to be waiting for him, but I must just tell you, we are lining up a host of doctors for you in the coming month. That is in the month of December. We have on the 23rd of December, which is a Saturday. We have a leading skin specialist who is going to be there. Sorry, a leading dietitian who's going to be there. In fact, the dietitian is somebody who advises on for patients with kidney ailments and uh, with ailments relating to the kidney. So she's going to be there on our session on the 23rd. There are a few other. There's our sponsor who's does the show will be doing it next week on the 2nd, as well as possibly on the 16th. We have some other doctors coming in on the 9th. We are not very sure. 6th, which is a Saturday. So that's the tentative plan for right now. We have taken your recommendations that have happened. One of the actually is on the basis of this recommendation that we've invited Dr. Jatin Kothari once again. As you know, we do look at issues concerning renal problems, kidney problems often enough, because that's something that concerns senior citizens a lot. We will also, one of the suggestions that came in was to have somebody for gastro, for the stomach. And as it happens, the month of December 2023 is, if I remember right, it's World Constipation. It's a constipation awareness month. So we will have somebody for that as well, possibly on the 9th of December. And yeah, that's our plan as of now. And we there are a host of things that we keep doing all through the week other than the health webinar. Seniors Have Talent just started last week on Wednesday. That is season 13 of Seniors Have Talent. And we've done Group A. We're going to be doing Group B onwards. The finale of that is going to be on Sunday, Jan 7th. And there are a host of other programs, yoga, meditation, wellness, etc. So, you must check out the site. You must check out the Evergreen Club app. Download it. It's available online on Android as well as Apple phones, Apple devices. We put the chat in the chat window. My colleague Firoz has put in the links for the downloading of the app. So please do that. It's a safe app. I must tell you that it's been there for a while now. It's now part of the Seniors Today family. So the Evergreen Club, and we are looking at doing a host of things. There'll be training programs that will also be there. Some of them free of cost, some of them paid for. But that's the plan, and I'm really looking forward to some of those things happening. We are still waiting for Dr. Kothari to come in. There's So until we have Dr. Kothari in, can I just request our producer to play the November issue video? So this is our November issue. And we've just got news that he is in the elevator, so he's going to be there in the next 2 minutes. So if you see a window popping next to mine, that's his. So we've got an article from Mr. Harsh Goenka here. There's a new column on Mind Matters, which is by Dr. Monica Das, that is there here. There's a wellness article on foods, tracking daily step counts. And there's a travel article by Travel to Vietnam. So, and of course, our story series, which is Elementary. So that's in the November issue of Seniors Today. As always, it is free of cost, so you don't have to pay anything. And this is issue number 53. If you want to access the last 52 issues of the magazine, you can also do that. And at the end of sometime in the show, we'll also put up various links that you can do. One is, if you look up the chat window, there's a subscription link which has been put up. You can subscribe to our newsletter, which is every day, Monday through Saturday. You can subscribe to it. You can pre-register for the health webinars that I always announce. So please pre-register for the health webinar, so you'll be informed about all our webinars, regardless of whether if you miss out on a certain announcement, you will get that. Seniors have talent. If you look up the chat window, we just put up the notice for registration. So in case you know anybody who can sing well, who should be 60 and above, yeah, so they can participate in this. For those of who have come in late, Dr. Jatin Kothari has been busy with a patient. He's going to be here in the next minute, I'm sure. I've been told. So he will be there. Yeah, so that's the announcements that is there. We'll also put up the announcement for the archives, the web of the magazine there. So you can look up the past issues of the web magazine on the website. Yeah, so that's there. Yeah, so Dr. Kothari is here. Hello, doctor. How are you?
Good evening. How are you?
Good evening.
Nice to see you again.
Yes, one of the last things we want to do is take a doctor away from his or her patient. So whenever I'm told, I hope the patient was doing well.
No, the patients are good. Just kept two people waiting, so they'll wait for half an hour till we finish our session.
Right. So welcome to Health Live at Seniors Today. We have here with us Dr. Jatin Kothari. Dr. Kothari has been with us in the past, last year. Before I request him to speak to us, I will just introduce him. Dr. Kothari is Director, Nephrology and Chief Consultant, Renal Transplant Medicine at the Nanavati Max Hospital in Mumbai. He's a DM in Nephrology and MD in Medicine from Bombay University, following his MBBS also from Mumbai. He's done a clinical fellowship in nephrology and transplantation from the University of Toronto. He's a visiting ISPD scientist at the University of Missouri in Columbia in the US, and an International Society of Nephrology Education Ambassador. He has done the ISN Global Outreach Program, the International Transplant Observership at the Massachusetts General Hospital in Boston, and the Roche Preceptorship in Kidney Transplantation at the University of Alabama in Birmingham in the US. He has an ISN ANIO Fellowship in Nephropathology and Preceptorship in Kidney Transplantation at the University of Toulouse in France. Dr. Kothari is former Joint Secretary of the Zonal Transplant Coordination Committee in Maharashtra from 2010 to 2016, a fellow of the Indian Society of Nephrology. He's a postgraduate teacher for DLB nephrology since 2006. That is 17 years at the Hindu Hospital. Interestingly, and I remember making a mention of this the last time around when he come, he's done a transformational leadership course for healthcare management from the International School of Business, the Indian School of Business in Hyderabad, and a certificate course on entrepreneurship in emerging economies from the online initiative of Harvard. He's currently pursuing his PhD in social entrepreneurship at the TISS in Mumbai. So welcome to Health Live at Seniors Today once again. Dr. Kothari, how have you been?
Everything is well. Thank you, Mr. Pradyuman, for having me again on this program. I guess the flavor of the day is to discuss about kidney disease in elderly.
That's right. That's what we've come for. We've got several requests for doing a session on kidney ailments. So over to you, doctor.
Sure. Okay, so as I understand, there are obviously a lot of concerns regarding kidney disease in patients who are senior citizens above the age of 65. So I'm not going to bore you with a lot of slides and a lot of material, but take some salient points which I want to get across to all the people who are listening to this session. We'll have a brief discussion on various topics pertaining to kidney health in the senior citizen category. We'll talk a little bit about how kidney function is affected by just when a person is aging and how kidney function can get impacted. We'll also talk about some routine things which all senior citizens, in my opinion, should be doing as a preventive measure to prevent kidney disease, because we all know that once kidney function gets affected beyond a point, all patients who develop kidney disease beyond stage 4 and 5 have a requirement of dialysis and transplant. And whatever we can do to try and prevent people from having kidney disease is extremely useful, and that we will have some discussion on that. A little bit about diabetes and hypertension and how it would impact the kidney function, because this is especially relevant for the senior citizens and for all the people who are listening to this program. So we'll briefly talk about that. Some things that are not discussed on forums like this, especially pertaining to kidney problems in the elderly population, is also something that I'm going to discuss about. So urinary tract infections, a little bit about, inability to control urine, what we call as incontinence. So just some tips on how you can handle these situations in the senior citizen category. A brief mention about prostatic problems in males who are beyond the age of 60. That's something that we need to be aware of, and what can we do to try and prevent it. And if at all it has happened, then how can you detect that problem early so that it doesn't lead to kidney disease down the line. And then some key messages about aspects like organ donation, which I am very passionate about, and some key messages. So I think this will be the format of the next 10 to 15 minutes of talk that I will give you. And after that, with the permission from Mr. Pradyuman, we can open up the session for questions and concerns that you may have. Is that reasonably okay, Mr. Pradyuman?
That's absolutely fine. So those of you who have questions, please put them in the Q&A tab. As always, mention your age and gender, and then we will take it up. I will pose all the questions to Dr. Kothari accordingly. Over to you, Doctor.
Great. Okay. So the first thing that I wanted to discuss was how does aging affect kidney function? We all know that as we age, in some ways we lose muscle mass, and the normal dictum that we are taught during our medical school is that once a person is beyond the age of 40, and this is something very important for all of you to understand and listen to, beyond the age of 40, each and every person who is living has a drop in kidney function by 1% every year. So what I'm trying to make you understand is that, say somebody is 80 years, then the kidney function normally, which should be 100%, drops to 60%. So over 40 years, beyond 40 years, so if your age is 40, your kidney function is 100%, but now your age is 80, so your kidney function automatically drops by 40%. So at the age of 80, if you have 60% kidney function, you should not be labeled as somebody who's got kidney disease. This is basically just the reduction of kidney function because of the whole process of aging. So sometimes when we label and when we see patients who come to us and ask us, what is my kidney function? I always take into account what is their age, and proportionate to the age, then only we would label them as to having kidney disease or not. So it's not automatic that everybody who's beyond the age of 40 has kidney failure or kidney disease. It's just that this factor needs to be taken into account. And this is something which is very important for all of you to understand, because sometimes you get increasingly anxious when you see a creatinine value being high, and you will rush to a doctor and keep worrying about kidney disease. Just keep it in mind that as we age, the kidney does become a little weak by itself. Coming to the most important point, I think, of today's discussion is how can senior citizens get their kidney function evaluated by simple things. And I'm sure that most of you are aware that detecting kidney function or detecting abnormalities in kidney function can be assessed by doing simple things, very simple things, some tests which do not cost you even more than 200 rupees. Things like doing a blood test, which is called a serum creatinine. I'm sure most of you have probably done this sometime during your life. But if you are a senior citizen and you've not done a creatinine, please get this message very clear that probably as early as Monday, you should get your creatinine checked, because that will give you a rough idea about how your kidney function is. Sometimes the creatinine may not estimate or may not be able to give you a clear picture as to how the kidney function is. In that situation, we rely on a simple test called as a urine test. And in this urine test, if we detect presence of any protein, normally the urine should not show any protein in or traces of protein in the urine test that we do from the laboratory. But in case it is seen that there are traces of protein seen, then you may have to do more tests to try and understand whether you have some kidney disease which is not manifesting in terms of symptoms or signs, but it can help us to detect kidney disease early. So two simple things, a serum creatinine, which is a blood test, and a simple urine test called as urine routine or a urine analysis will help us to detect kidney disease in this category of patients. Coming to diabetes and hypertension, as I mentioned, these are the two commonest causes of chronic kidney disease in the world. And the elderly or the senior citizen category also, it is not different. So the same two causes, that is diabetes and high blood pressure, both of these happening together, in fact, increases the chance of having kidney problems almost to the fold of 5 times. So if somebody's got diabetes or high blood pressure or both, then they need to be extra careful, and they need to make sure that they do the kidney evaluation probably once in a year. So this is something which is very important. Sometimes when diabetic patients have normal kidney function, they come to my clinic and they say that, my kidney function is normal, so why are you labeling me as a kidney disease? It's important for patients who have diabetes to understand that diabetic kidney disease is divided into 5 stages. And the first 2 stages of diabetes and kidney disease, your kidney function may be absolutely normal. So the only way that you could pick up that there is an early kidney disease is by doing the urine test, which I just mentioned. And there is one specialized test called as a urine albumin to creatinine ratio. Now, this is done by all laboratories. It doesn't cost more than 200 rupees. So do this test, which will, especially for all the diabetic patients who are listening to this program, please make sure that you do this urine albumin to creatinine ratio, because that will help you to find out whether you have early diabetic kidney disease. And if detected on the early stage, then we can sometimes even reverse this, and you can be free of kidney disease in the future. So that's something that is a message, key message for all the diabetic people who are listening to this talk. Let's come to some specific things like urinary tract infections. Now, I know that some of the senior citizens have difficulty in terms of passing urine. Sometimes they are not able to control the flow of urine. If the social environment is not correct and they have to hold urine for a long time, that also can sometimes leads to urine retention, and that itself can predispose them to have urinary tract infection. Now, it's very different to deal with urinary tract infection in the senior citizen category compared to somebody who's a young female in the reproductive age group, where simple things like doing a gynecological examination, giving some simple antibiotics can cure the urine infection. In elderly population, in senior citizens, we sometimes face a lot of difficulties because of the urinary tract infection because of 2 things. One is if the urinary flow is not good, then they develop urinary retention, and sometimes this can impact the kidney function. So that's one thing which we are worried about. And second thing, most of the antibiotics that we use for urinary tract infection in elderly population, it may have a tendency to cause more side effects. So if we can avoid somebody from having a urinary tract infection in the senior citizen category, I think that is the best way of handling this problem. Coming to male patients who are listening to this program, again from the senior citizen category, something that you need to be aware of, that all males are born with a prostate gland, which is surrounding the bladder. And as we age, the prostate gland increases in size. The mere increase of the size of the prostate, it need not be cancer. So every time you have prostate enlargement, you need to understand that it's not cancer. It's just a benign enlargement or an age-related enlargement of the prostate. This can lead to urinary problems in terms of urgency. You can't hold urine. You have to pass urine frequently. In this situation, if you do an early detection of the prostate enlargement, having a clinical examination done by a urologist or a physician, that can help us to pick up the benign enlargement of the prostate. And even a simple blood test, and most of the people must have heard about this blood test, it's called a prostate specific antigen or a PSA test. This PSA test, if it is elevated, above the normal range, then that can help us to pick up, benign enlargement of the prostate, or whether there is any infection in the prostate. And if treated appropriately, this can help you to relieve the symptoms of the prostate enlargement, and you may not require surgery if this is detected on the early stage. So this is something which is again important for all the male, people who are attending this program. Keep a watch on your urinary symptoms. In case you have any symptoms which point towards a prostate enlargement, please consult a urologist, get a PSA test done, and then take the routine advice what is given by the urologist. Next, I wanted to point out a couple of things, and this question keeps coming off and on whenever I address, any senior citizen category of patients or people. As to what is the cutoff for organ donation. A lot of people are now aware, getting more and more aware about organ donation. So organ donation can be done in two ways. One is when we die or when we are going to die, we pledge our organs when we are alive. So it's very important that anybody who's keen on organ donation after their death can definitely do that during their lifetime. Please make sure that you sign an organ donor card. We can help you with providing you with the organ donor card. But the most important thing about organ donation after your death is that while you are living, you will have to communicate your wish to your next of kin. As of now, the Indian laws do not permit us to have presumed consent. Say, for example, you have pledged your organs. We cannot remove your organs without the consent of your relatives and next family members. So please make sure that they are also aware of your wish to donate or that you have pledged your organs, so that after your death, if your death happens because of some unnatural cause like a vehicular accident or, for example, of a brain hemorrhage, then up to 8 to 10 patients with end-stage organ problems like kidney failure and liver failure, we can benefit 8 to 10 people's lives and make a difference by donating all our organs. So the common question that I'm asked about organ donation is, what is the age cutoff? As of now, the age cutoff, there is nothing like an age cutoff. We have people who have donated their organs even at the age of 80 years. When they've passed away and they've pledged their organs. At the same time, sometimes we have young people who have medical problems and they cannot donate their organs. Say, for example, they have unfortunately developed some cancer, or if they have infection at the time when they pass away, those situations we may not be able to use the organs. So what I want to give you a key message is that age is not a criteria by which we can restrict or limit organ donation. You can very well donate your organs. Everybody is aware that eye donation is done, even 85-year-old people who've got good eyesight, and they can actually donate their corneas to people who need it. In similar way, organs also can be preserved and can be used and can be beneficial to a lot of patients who require these organs. Number two question, which also keeps coming up, is that if during my lifetime, can I be an organ donor? So the only organs that you can you donate, and that also the donation would happen to some family member. You cannot donate to a stranger. Unfortunately, in the Indian scenario, in the Organ Transplantation Act, as per now, only relatives can donate to their next of kin or family members. So the only two organs that you can donate, I'm sure most of you are aware, is one is kidney, because God has given us two kidneys. In fact, most of us have two kidneys. Some of us who are here listening to this program may have one kidney also. The incidence of having one kidney by birth is about 1 in 1,000. So if there are 1,000 people attending this session, I can say that one person out of them may be born with one kidney. But more or less, most of us are born with two kidneys. So we have actually been given one kidney in spare by God. We actually don't need two kidneys for a normal lifespan. So kidney is the commonest organ that is donated during your living time. And the second thing that you can actually donate is even a part of your liver. So, there are a lot of liver transplants that are happening across India and across the world, where there are living donors from the family who donate one part of their liver to their family member who needs that for liver failure. So organ donation is something that I'm very passionate about, and that's why I wanted to make this point to this audience that do pledge your organs and try and save lives even after you are dead. That will make sure that you continue to remain alive even after we are dead. And these organs can be used for all needy people who require to survive with those organs. So that's the second last point which I wanted to mention. The last point before I end is I wanted to talk about use of medications in the senior citizen category. I know that sometimes there is reluctance of going to a doctor and use medications by yourself. What I'm trying to say is that a lot of times we develop cold and cough and fever. We self-medicate. We don't even consult a doctor, and we consume these medications. Sometimes in the population that we are dealing with, especially people who are more than 75 years of age, even the so-called benign medicines or the over-the-counter medications which are available in India can lead to problems because you have lower muscle mass. Your kidney function might also be low because of the age. So you do need to consult a doctor before you take any medications. This especially applies to people who take antibiotics and antacids. We develop acidity after a spicy meal. We go ahead and pop a tablet of an antacid, maybe a pantoprazole or something. Please don't do that without consultation of the doctor. It's very important that we protect our kidneys. Most of the times, kidney patients do not have symptoms. So unless and until you do a blood test or a urine test, or you be careful, you may not be even aware. Even if you lose 50% of kidney function, you may not develop any symptom at all. So always, prevention is always better than cure, as we've been hearing over the ages. And something that we can prevent from happening, all of us should make an attempt of trying to do that. And I think this is one of the most key messages that I wanted to give to all of you, that please don't self-medicate. At least try and take an advice of a family doctor or a physician. Make him aware that you are taking this medication, and hopefully that is not interacting with any of your other tablets which you are taking for heart conditions or blood pressure or diabetes. So make sure that we take all these precautions. The last point that I want to make before I end is talking about water intake and food. So I did have a conversation with Mr. Pradyuman earlier in the day, and I think obviously diet is a very important part of how we maintain health. And at some point in time, he's going to get a special session for all of you where a good dietitian is going to talk to you about how you maintain good health, and especially pertaining to good kidney health. But water intake is one common question which is asked, and I'm sure somebody's already put that in the chat box, as to how much water is required to maintain good kidney function. So as long as your kidney function is reasonably okay and your parameters are okay, 6 to 8 glasses of water is what we encourage people to drink. So that's up to 2 liters. There are a lot of people who are obsessed with drinking more and more water. So I've heard of people who drink 2 liters every 4 hours and go up to 10 liters per day. Actually, that amount of water intake is not required for most patients. And up to 2 liters of water intake would be reasonably good to maintain good kidney health. So this is something that all of you can keep in mind in terms of how we can help reduce the burden of kidney disease, which is going to newer levels every day. It is probably one of the biggest pandemics that we've been facing, and the whole world is facing over the last 30, 40 years. So whatever we can try and do to try and reduce the burden of kidney disease, that will be helpful to more and more people. So I think I will end here, and I would now request Mr. Pradyuman to open up the session for all possible questions and concerns that everybody would have. Thank you very much for your kind attention.
Thank you very much, Dr. Kothari. As always, you've been very candid and clear in everything that you've said. Doctor, on a lighter note, I must ask you this. You've been in the business for so many years, and you mentioned about self-medication. Now, tell me, how many of your patients actually listen to you on that?
That's a very, very tough question to answer on a public forum like this. But I can assure you that probably the population that we are talking to today, the senior citizens, are much better off than the younger lot. I would say that the younger lot of patients that I see, it is more difficult to convince them to take proper advice and proper medications. Somehow, with google.com and all the other possible avenues of getting information, people have started self-medicating themselves tremendously. Unfortunately, in our country, most of these medications are available over the counter. You are not even asked for a medical prescription or a doctor's prescription for taking all these medications. So these are some unfortunate things that are prevalent in our country. But the more vigilant we are, and not to increase my business, I don't think I'm in a business. I'm here to try and help as many people to have less kidney problems. I already have too many kidney patients, as you can understand, and we are only 3,000 kidney doctors in India. So to look after 140 crore people with only 3,000 kidney specialists, it's a huge burden that we are dealing with. So whatever little we can do to try and improve compliance and prevent kidney disease is what we are trying to achieve. So,
Doctor, I'm going to ask you a pointed question on this. Yes. What are the medicines that are absolute no-nos without medical consultation?
Wonderful question. I would say that other than taking a paracetamol, or other than taking maybe a Sinarest or something for cough and cold, I would not advise anybody who's listening to this program to take medications without advice of a physician. That's number one. Number two, to your pointed question, which are the medications which harm the kidney the maximum? I would say the ranking is as follows. Number one on the list is painkillers, number one. And taking painkillers for muscle pain, headache, just pop in a Saridon, take a Vovaran for back pain. This is the most dangerous thing that we can do for ourselves. So yes, if monitored well, you can probably take the painkiller even for a few days. Sometimes if you have a fall and you have a fracture, yes, you would have to take a painkiller. But this has to be done in consultation with a medical expert. So number one is painkillers. Number two is antibiotics. A lot of people take antibiotics without even knowing that sometimes they can harm the kidneys. So these are the number two, one and two. And something which I'm sure most people are not aware of is Ayurvedic medications. What we sort of think about herbal medications and alternative medications is it does not have side effects. Let me tell you that half of the dialysis patients that I'm dealing with, and I continue to deal with this, is that these Ayurvedic medications do contain traces of heavy metals. And this can affect the kidney, this can damage the kidney, this can lead to kidney failure. And a lot of my dialysis patients, where we don't find the cause of their kidney problems, we sometimes come to know years down the line that they were consuming some Ayurvedic medicines for joint pains and arthritis and asthma. And that's another common cause of kidney failure in India. So painkillers, antibiotics, Ayurvedic medications, these three are an absolute no for anybody who's got kidney disease, and for sure, even for people who don't have kidney disease, because these can lead to kidney disease in the future.
Right. Thank you, doctor. You've been as candid as possible, but tell me something. This whole thing about you mentioning about Ayurveda now, this is a constant battle between allopathic and Ayurveda, right? For donkey's years, for time immemorial in India, we've been, Ayurvedic medicines, the jari booties, etc., have been there, and there are documents, there are books written on that. So clearly, well, all of this is being said, and during the COVID time, there was a fair amount of discussion about the negatives of Ayurvedic medicines. But I think what you're trying to say is that whatever medicines you should take should be post the advice of a medical doctor.
Absolutely, absolutely. I have nothing against alternative medicines, and I can genuinely express my concern regarding this. There are some conditions where actually all these alternative medicines do work well, and I myself have consumed sometimes Ayurvedic medicines and homeopathic medicines, especially from genuine homeopaths. I have a lot of friends in homeopathy also, so nothing against that. But these are in some limited conditions where we have to use a combination of various, allopathy and homeopathy together, etc., etc. So as long as you are doing these treatments with a qualified, physician or a homeopath or an Ayurvedic person, I don't have problems with that. My problem is that when people go to 5 different types of doctors and then take combination of everything, as an allopath, I don't know what the Ayurvedic medicine person is prescribing, and vice versa. So in that situation, the only person who's getting harmed is the patient himself. And that's something that you need to keep in mind. If you are convinced about a particular allopathy or a homeopathy or whatever, please follow that, but make sure that you are taking the advice from the right person. Please don't go to a pharmacy and tell them the symptoms and take the medicines. That's not the right way of doing things. That's my key message. Yeah.
Absolutely. And to everybody here as well, those of you who have asked specific questions, there's somebody who said, can I send my latest lab report? The thing is that we organize the health webinar as an advisory feature. There's nothing like speaking to your doctor directly, getting a clinical examination. And of course, you can also reach Dr. Jatin Kothari at the Nanavati Max Hospital and take his opinion. But do remember that we will not be able to give you specific advice over here, because even though we want to. Doctor, I'll get to the questions now. This is a question from Kamlesh Vajpayee, who's 70. He has high BP, no diabetes. Recently, his uric acid turned out to be 8. Febujet was prescribed. His questions are how to control it and food to avoid. Food, I must just tell you, Dr. Kothari mentioned, and I spoke to the amazing dietitian whom he advised, and we are going to have the lady come in on December 23rd. December 23rd is when she's going to be there. So
okay.
We will discuss all of that. So we were fairly quick on that. So yeah, so his question is, should he have Febujet to control his uric acid of 8?
So great question. I have a session on this next Saturday where I'm debating with a colleague of mine, and I'm addressing almost 200 physicians from Kalyan Dombivli area on this topic only, as to whether you should treat the number. My simple answer to that is we don't care about your uric acid number, whether it is 8 or 10 or 15, it doesn't matter. We really need to know what is the cause or what is the reason why your uric acid is high, and whether there is any problem that you are facing because of the high uric acid. Treating the number is probably the worst that we can do for an individual patient. So my simple answer to this gentleman is that do not bother about the uric acid. As long as your physician is treating you with the appropriate medications. Yes, there are some dietary changes, and I'm very glad that Mr. Pradyuman has already set up a topic coming this next month itself, where this problem will be advised. The diet advice will be provided to you. But on a general term, just restricting red meat. So if somebody is non-vegetarian, that's something that you should try and avoid. Chocolates have a lot of uric acid, so that's something that you need to stop consuming. Make sure your fluid intake is good. And bottom line is, don't bother about the uric acid number. As long as there are no symptoms, don't bother about it. And hopefully your physician also will not be giving you medications to treat the number. That's my advice to you.
Thank you. We have a question from Mr. Rameshandra Desai. His question is, when a 72-year-old lady patient with non-controllable brittle diabetes is consulting a nephrologist for CKD, should the patient also be required to consult an endocrinologist?
Yeah. This is a very good question. Most of the patients are, bidirectional. So endocrinologists send me a lot of patients, and I also send some of my patients to the endocrinologist, because as we all know, diabetes can affect multiple systems. So invariably, a patient who's had long-standing diabetes will have to see 3 doctors. They will have to see the endocrinologist probably once in 6 months. They would have to see the nephrologist maybe once in a year. And if your endocrinologist is very good and competent, and if he is able to handle the kidney problem, especially in the early stages, you may not need to see a nephrologist. The other person that you need to be aware of, which you need to see regularly, is an ophthalmologist, because your retina also needs to be evaluated when you have long-standing diabetes. So this question is more generic. Yes, depending on the individual situation, we would guide you to go back to endocrinologist, but your primary doctor remains the endocrinologist till you say have kidney failure, and then you come under a nephrologist. So most of these patients will be handled by the endocrinologists themselves.
Right. Thank you, doctor. We have a question from Mr. Sridhar Chatur, whose wife, 72, has cyst in kidney. Her mother, brother, sister died of the same. She's on medication. Nephrologist is at Sagar Hospital in Bangalore. Not diabetic, slight BP. He wants advice.
Yeah. So I would not want to give you specific advice, but just some general observations. Yes, there is a strong family history that you have probably got a condition called as polycystic kidney disease in the family. This needs to be attended to for sure, and I'm sure the doctors at Sagar are trying to do their best to maintain kidney function. But yes, you will require medical advice, and please continue to follow up with the nephrologist, because sometimes these cysts in the kidney can progress to kidney failure, as you seem to have indicated. So please be careful, do a proper diet, do a proper follow-up with the nephrologist whom you are seeing in Bangalore.
Right. To Mr. Chitur, this session is being recorded, and it will be there available on Seniors Today website on Monday evening. I'm also going to be putting in the link to the last session that Dr. Kothari had conducted, so you can also have a look at that. Doctor, I know you mentioned this, but since there are a couple of questions that have come in again, this is from Mr. Sushil Kumar, who's 76. He says after he drinks water, within 30 minutes, he needs to go to the washroom. Is it worrisome? And there's a question from Mini Gogia, who says, what are the specific rules for drinking water? So could you repeat that?
Right. So water intake, I think we have covered, Mr. Pradyuman. But as far as, if you have severe urgency of urination, say you drink water and then you have to go immediately, and the frequency is higher at the age of 72, yes, I would get that person evaluated for a prostate-related problem. That's the only thing that I would be getting checked on. But otherwise, it's a normal phenomenon, right? We all drink water, and we have to use the washroom depending on how much our bladder capacity is. Some people are able to retain for 2 hours, 3 hours. Some people have a tendency of using the washroom every hour. So nothing wrong with it. But if this problem persists and if there is increased frequency, especially at night, then I would be definitely seeking a urology consultation and get the prostate evaluated.
Doctor, we have a question from Marjorie Fernandez, which is interesting. Can the intake of 2 liters of water, should it include tea, coffee, lassi, etc.? And what about the difference in intake of water during summer and winter? One feels very thirsty when one doesn't feel very thirsty in winter, and hence the intake of water would be much lesser in winter as compared to summer.
Great question. Yes, the water intake depends on what temperature, whether you are indoors, outdoors, how much you sweat. There are so many factors, yes. But as a general rule of thumb, as I mentioned, if your kidney function is okay, then 8 glasses of water is good enough. When I say water, it essentially means any type of liquid. So we don't count the colas, etc. Ideally, I mean, we don't want too many people to drink colas, etc. For obvious reasons. But water intake, lime juice, any fruit juice, all those can be counted as liquids essentially. So 2 liters of liquid intake also would be reasonably okay for most patients. Although, if your kidney function is affected to some extent, then we would ask you to refrain from a particular type of juice or a particular type of liquid. But other than that, 8 glasses of any liquid would be more or less good enough for everybody who's got reasonably good kidney function.
Right. Thank you. We have a question from Katie Daranchi, who's 72. She writes that during a urine routine test, the protein albumin level is 1+, and the pus cells are 10 to 15 NPF. Should how can she bring the pus cells down?
Right. So again, in this, the focus is on the report. I would decide on treating this particular person based on the symptoms. So in my opinion, the pus cells doesn't matter. It doesn't mean anything as long as the person is not having symptoms. If this person has a urinary tract infection and symptoms of urinary tract infection, then yes, I would be looking at that for sure. Now, sometimes when we develop a urine infection, the urine report does indicate some traces of protein. So it may not be a separate problem, but in case there is an infection and we treat the infection, and after treating the infection, if we still see that there are some traces of protein remaining behind in the urine report done later on, then yes, that needs to be addressed as to why there is protein leakage. In the presence of infection, I would not be worried about that report. But once the infection is treated, we need to look at this. So other than this, don't bother about the urine reports and all the blood reports. I know nowadays, patients have the habit of looking at the report. It's usually a 20, 25 page report with a lot of dark markings and different color codes, etc. Don't start interpreting all these reports, because even normal reports, there are, ranges, etc. And every individual report that is marked doesn't mean that you have a disease. It's just an observation from the laboratory person. So no issue with dealing with everything that is abnormally marked on the report. But stop looking at all these things and have a good physician who can help you to decide on whether you need treatment at all for all these reports.
Right. Thank you. Doctor, it's 5:45. I know we have 5 minutes more. We have a question from an anonymous attendee who's 77, a lady. She says she needs to pass urine 3 to 4 times every night. She wakes up very thirsty, so she has to drink water 2 each time. It's perhaps like a vicious.
Yeah. So I think the message would be very clear that if you can stop drinking water, I know it's difficult sometimes where you feel very dry, and if you are on some medication which leads to mouth dryness. But try and avoid taking the water, especially when you get up in the night to pass urine. That itself may help you to reduce the frequency of getting up, and hopefully that problem can be averted. In case this is a persistent problem, then yes, definitely you should be evaluated, because it's not normal for somebody even at the age of 85 to get up 4 or 5 times. So that's something that may need evaluation. But per se, try and reduce the water intake after 9 p.m. to try and get the frequency of getting up down. Yeah.
Right. Doctor, one last question. I know you mentioned this, but Madhu A, and this is a common problem. What are the symptoms of UTI that one should be careful about?
Yeah. So fever, flank pain. When I say flank pain, is at the back, just below the ribs. If you have very severe pain, presence of fever, and of course urinary symptoms like burning in the urine or passing any blood in the urine are usually the signs where we would suspect a urine infection. And people who've had urine infection in the past, they can make out immediately whether they have a urine infection or starting of a urine infection. So they need to be vigilant. Don't rely on only the urine routine. If you have a genuine urine infection, the only way to detect and confirm the urine infection is doing a test called as a urine culture. I'm sure everybody is aware of that. Yes, it is a little more expensive than doing a urine routine, but it gives you much more information, and accurate treatment is based on the urine culture report. So that's something that I would recommend people to do in case they have any of these symptoms of urinary tract infection.
Right. Doctor, 2 questions. One is presence of protein in urine. Is that the only symptom of failure of kidney function?
So that's one of the things. And as I mentioned, also doing a serum creatinine and your age-related creatinine and GFR calculation, which is available in most of the laboratory reports nowadays, does help you to find out whether you have an early kidney disease. So these are the 2 routine tests that we do. Yes, of course, we have a lot of other tests that you can do in consultation with your physician or nephrologist.
Does Parkinson's medicine, does it affect the kidneys?
Not directly to the kidneys, but yes, it can impact the bladder function. And if that problem is not addressed, then sometimes the bladder issue can lead to pressure changes on the kidney and can impact the kidney also. So something that needs to be looked at. And I'm sure whoever is the neurologist or physician treating you for the Parkinson's will make sure that your urine flow, etc., is normal. And if at all there is a side effect of one of those medicines, then they would give you counter medicines to prevent that from happening.
Right. Mr. Sridhar Chittur, I would advise that you should take specific questions to your doctor directly so that you could get a better reply. There are quite a few other questions that have come in, but they are repeats of what doctor has already mentioned. So I would recommend that you look up the recording of this session and the takeaways which are written by a medical practitioner on Monday evening, and you can have a look at the session. You can hear Dr. Jatin Kothari once again and his responses to all the questions, which have been very candid. Thank you very much once again, Dr. Kothari, for being here, and thank you to the Nanavati Max Hospital team to having facilitated this. It's always a pleasure having you here. Dr. Kothari, before you leave, I would like to do a session once on organ donation, and perhaps we will speak once again. And
absolutely, no, I would be happy to, and thank you for having me again, Mr. Pradyuman. It's always a pleasure to interact with. You've got a big group of people who are very interested in knowing about a little bit about scientific information. So, very happy to be a part of your program. Thank you very much.
Thank you very much. Thank you very much once again. And the link to Dr. Kothari's last session is there over here. And of course, if you wait for 2 more days, you'll have a link to, you'll have this session as well. Thank you very much once again. And to you there, we will be back once again with a Health Live at Seniors Today session. As I mentioned, next week, which is December 2nd, there is the sponsored session, and we will be back. I will be back again on